Good evening. Thank you for joining us for tonight's Lung Life webinar, PhysioYoga, a wellness celebration of Lung Month with physiotherapist Linda Boryski. My name is Jill Hubick. I am a registered nurse and certified respiratory educator with Lung Saskatchewan. It is my pleasure to welcome you and to be your host and moderator. Before we begin the presentation tonight, we would like to acknowledge that the land we are hosting this webinar on is on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, as well as the territory of the Métis. We would like to acknowledge the many First Nations, Métis, and Inuit whose footsteps have marked these lands for generations, and we are so very grateful we are able to host this event where we are. On behalf of Lung Saskatchewan, I would like to take a moment to acknowledge the healthcare providers and the champions in lung health. Healthcare providers have and continue to go above and beyond with their efforts during this pandemic. So, to all the healthcare providers, thank you. Thank you from the bottom of our hearts and lungs. The pandemic certainly has been challenging for all of us, especially for people with lung disease. Supporting and helping people living with and caring for people with lung disease is definitely a priority for Lung Saskatchewan. We offer a variety of online support groups for patients and caregivers. Our support groups include asthma, COPD, pulmonary fibrosis, COVID 19, lung cancer, lung transplant, sleep apnea, and Saskatchewan Quits to help people quit smoking. These support groups are here to help you or your loved ones living with lung disease. They're also a way to help you quit smoking and navigate your journey in a safe and supportive way. Tonight's webinar, PhysioYoga, a wellness celebration of Lung Month, is dedicated to raising awareness about lung health. It is meant to honor the healthcare providers that work with people living with lung disease, the members in all our support group spaces, people caring for people living with lung disease, and really, it is meant for anyone who has lungs. So, if you're not a member of our Lung Saskatchewan support group but you'd like to be, we would like to have you. Join us by visiting lungsask.ca. We are excited about our presenter tonight. Prior to becoming a physiotherapist in 1999, Linda Boryski competed at a national level in 4 different sports, and this is really cool. She medaled in 2 of them. She brings that same commitment to excellence and teamwork to her Saskatoon PhysioYoga. Linda chose to elevate her physiotherapy practice by completing her professional yoga therapy certification. And she was the first in Saskatchewan, and she's only one of 5 to have this certification. So we're so lucky to have her here tonight. Linda empowers independent learners, especially those who are proactive in their health and ready to go all in. She guides them to take control of their lives, to make the changes they know they can make, and to live the life they desire. Following Linda's presentation, we will have time for a moderated question and answer period. If you have questions for Linda, please type your questions into the question feature of the webinar software. We will do our best to get to all of them. Tonight's session, focused on empowerment and balance, is really a great way to celebrate Lung Month. And I think it is also very fitting that it is our 5th and final webinar of the Lung Life webinar series, which is sponsored by GSK. Lung Saskatchewan and GSK have a long history of working together on activities that improve the lives of those living with lung disease. The education webinar series Lung Life was created to empower those living with and caring for those with lung disease to live better. Over the past year, we've heard from experts on COVID-19 treatments, asthma and exercise, asthma control, avoiding the September spike, and strategies to help you quit smoking. If you missed any of these webinars, we hope you'll visit our website, lungsas.ca, to view their recordings. So here is a short video highlighting the series. This series would not have been possible without GSK, a science led global healthcare company with a special purpose to unite science, technology, and talent to get ahead of disease together. This webinar series is just one example as to how GSK and Lung Saskatchewan have worked to move ahead together. I'm so pleased to welcome Marie-Claude from GSK to bring greetings and to welcome our presenter.
Welcome everyone. My name is Marie-Claude Desaulniers. I am the Patient Engagement Manager at GSK. What we do as GSK is we unite science, talent, and technology to get ahead of disease together. And this is why we're very happy to collaborate with Lung Saskatchewan and to sponsor the Long Life webinar series. To celebrate Lung Month, yes, it is important to speak about lung disease, but also very important to speak about overall wellness. So this is why I'm very happy to welcome you tonight to this wonderful PhysioYoga session. I hope you will enjoy. Good night.
Oh, well, thank you so much, Jill. And a big shout out thank you to Lung Sask for putting on this amazing webinar series and for having me be part of it. And another big thank you to GSK for sponsorship of this series. So I would like to start with everybody just taking a few moments to become still. And please don't be afraid or nervous. Because if this isn't for you, then I give you full permission, and please give yourself some permission to go and get a cup of tea and join us back here in a few minutes. But for those who do wish to join me in this, yeah, we're just going to get still for a few moments. So go ahead and get super comfortable, okay? And this won't be more than 5 minutes. So you can keep your eyes open if you wish. And if you do keep your eyes open, I ask that you just lower your gaze, maybe turn your phone and your screens over or off so that there's fewer distractions, and lowering your gaze can help with distractions as well. And if you're comfortable, go ahead and let your eyes drift closed too. And remember another permission here, permission slip. Go ahead and stop participating in this little practice if it feels unsafe or uncomfortable for you in any way at any time. Just pause for a moment and join up with us at the end. So first I'll invite you to check in with your physical body. Notice any physical sensations. Maybe you start from the head and work through the body down to your toes. And just take notice of anything that comes up for you. Maybe you have cold toes or you're super warm right now. Maybe you notice an area of physical pain or tension. But I ask that you also take note of any areas in the body that do not have any physical sensation right now, where the temperature is just neutral and there's no pain, there's no tension. And now check in with your mind. What are you thinking right now? Or maybe what emotions are you feeling? And we don't need to attach judgment to your thoughts or your emotions. There is nothing that is right nor wrong, and there is nothing that is good nor bad right now. And finally, I'll ask you to check in with your spirit or your energy. What are your energy levels like right now? Are you winding down for the day, or did you just get another wind ready to go? And then maybe too, you can identify without judgment the quality of that energy. Is it optimistic and hopeful? Or is it a little bit easier to see the glass is half empty right now? No judgment. Nothing is right nor wrong, good nor bad. All right, so just I'll let you sit for silence just for a few more moments. And as we come into a close of this little practice, just allow your chin to lower towards your chest. If your eyes drifted closed, you can open them. Bring a little bit of focus to your eyes. And then lift your chin and you can engage with your screen again. And thank you. Full disclosure, I always like to start my presentations with a little bit of a stillness practice, and that's for my own nerves as much as anything else. But thank you for coming along with me on that. All right, today's presentation is empowering through the mind, body, and spirit. So empowerment. You know, these are still such uncertain times. And I'm sure in March of 2020, we thought that by November of 22, we'd be through the worst of this pandemic by now. And yet sometimes the news doesn't sound very hopeful. And there's lots of talk about burnout and sick kids and COVID plus flu plus RSV. Oh, and then medication shortages on top of everything. And it just seems like kind of things are spinning a little bit again. So I thought, what if I could use today to give the listeners just a wee little bit of control and a wee sense of empowerment? So I'm going to try to do that. So the World Health Organization defines empowerment as a process through which people gain greater control over decisions and actions affecting their health. So they gain greater control, not full control, right? But greater control, okay? And it talks about a process. I like that. Let's look at another definition. Empowerment refers to the process by which people gain control over factors and decisions that shape their lives. It is the process by which they increase their assets and attributes. They build capacities to gain access, partners, networks, and or a voice in order to gain control. So what really stands out there for me is that it's a process. I might even say it's kind of an evolution. Okay? And the goal is to increase our assets and build our capacities. And I really like in here to gain that voice. So let's look at a situation here in this photo. And let's just kind of peel back some of the layers here for empowerment. So this photo shows a patient, presumably in a hospital bed, with 2, 4, 5 professionals around him. Everybody's smiling, and it looks better than many thoughts of, many situations I can think of in the hospital setting. Okay. So in this traditional healthcare setting, let's look at the elements of empowerment. So for the healthcare team, what I see here is collaboration. Perhaps there's the opportunity for education of each other, but also of the patient. There appears to be some consultation. There's certainly some engagement amongst the team members. And I trust, because I like to trust, that everybody is coming from the point of their best effort and their best intentions. Okay. Now let's look at empowerment here in this situation for the patient. The smile is on his face, but I don't know, here's what I see. I see a power differential. Okay. I see presumably a knowledge gap. In this picture, there is one patient and 5 professionals, 5 white coats, 5 experts. So it's one versus many. I also see the patient lying down, and all the others are standing and looking down. But yet no one is directly speaking or looking at the patient. And I also see that this patient is alone with no visible support or family. There's no one who's not a healthcare team member along that patient's side. So I think the intentions of this photo are good, and it looks like this is kind of a collaborative space and supportive, but yet at the same time, I can really see where it might not be very empowering for this patient. So I'll just take a few moments here and ask you to think back to a time in a healthcare setting where you or a loved one felt powerless or out of control, maybe outnumbered. And then, is there anything that you would have liked to have seen changed about that situation? And this is just personal reflection. Just take a moment. All right. So we're going to shift gears a little bit and talk about mind, body, spirit, and empowerment. And before we shift into that, I want to go into a little bit of history about mind, body, and spirit approach in medicine. So currently, modern medicine is extremely focused on disciplines. Okay, and this is known as the biomedical approach, and specialties exist. There's cardiology for the heart, there's hematology for the blood, there's endocrinology for hormones, psychology and psychiatry for mental health. Okay, so all of these silos within our healthcare system, and it allows for great expertise and extremely focused and effective training and treatment. It's really amazing. Okay? But it's not perfect, and there are gaps in this approach. Okay? And I think the biggest gap comes in the fact that the human body is so incredibly integrated. It's such an integrated machine that the heart does not exist or function in isolation. So we have the heart or cardiology, but it's also impacted by hormones and the hormones and the blood and stress and, even past experiences. But in 1977, a gentleman by the name of George Engel, he proposed the biopsychosocial model, and it was first conceptualized by this George Engel. And it was suggesting that to understand a person's medical condition is not simply the biological factors to consider, but also the psychological and social factors. So that's the biology, right? The actual human body, but also psychology and social factors. And I think George Engel's one most enduring contribution was to broaden the scope of a clinician's gaze. And his biopsychosocial model, it was a call to change our understanding of the patient and to expand the domain of medical knowledge and address more diverse needs of each patient. Okay? And it's perhaps the transformation of the way illness, suffering, and healing were viewed by the medical professions. So that was in 1977. All right. So on the left side of the screen, the biopsychosocial approach, bio, psycho, and social, and that's the Western medicine model. And on the right-hand side, we have some yogic koshas. So prior to 1977, the world of yoga and other traditional or ancient approaches to wellness, maybe traditional Chinese medicine, Ayurveda, indigenous medicine practices, they had a much more broad scope of wellness figured out long before 1977. I'm going to talk about the yogic world because that's kind of where I live some of my professional life in. And it's the yogic koshas, which describe kind of the mind, what's equivalent to the mind, body, spirit for the Western medicine. Okay. So there's 5 koshas or sheaths. Here's a nice graphic. Okay. So we have Annamaya kosha, which is a physical body. Pranamaya kosha, which is vital energy. Mananamaya kosha, which is the mental sheath. The Nanamaya kosha, which is wisdom. And Anandamaya kosha, which is bliss. Okay, so that's how yoga approaches wellness within the body. And if there's imbalance in one of these koshas, then the entire system is out of balance a little bit. So think back to the beginning of the presentation today, and I asked you to participate in a little practice with me. And it was a mind-body scan. I asked you to check in with your physical body, temperature, pain, also areas of no pain, right? Then I asked you to check in with your mind and your spirit. And within those 5 minutes, you were beginning to explore some of these koshas. So if we take the koshas as a form of empowerment and healthy aging, because I bet most of us would say healthy aging would be something I'd really love, okay? And let's see where that leads us to. So healthy aging, and for many people, that means a balanced management of chronic conditions, okay? So you've already got chronic conditions, and you just want to balance them the best and manage them the best that you can, okay? But it's also, healthy aging is also having the ability and the resources to manage acute situations too. So whatever it is, chronic or acute, a full holistic approach should and can include all 5 of these sheaths. Okay? The physical, energetic, bio-emotional, social, intellectual, and spiritual. So the physical body, obviously, the energetic piece can be, in practice, I talked about it being like mindset, positive or negative outlook, also energy levels. The psycho-emotional social, which is the emotional sense and social connectedness. Intellectual sheath is our intelligence. It's how we like to learn. It's our own learning capacity. And it's what we know and what we're willing to learn. And then there's a spiritual sheath, and that's connectedness, maybe to a source, a God or something, or maybe it's social connection. And I think what we need to be aware of is there's a fair bit of overlap within these 5 koshas. Okay? And sometimes I say mind, body, spirit, And I kind of mean the same thing as the koshas. And I think a true yogi might get after me about that for not being specific enough. But for the sake of today, I'm going to interchange those, because mind, body, spirit from the Western medicine world, or with the 5 koshas from the yogic world, there's a fair bit of overlap between the different layers. So let me speak to that. Examples: limitations in the physical body. So maybe you've had an accident and now you are off of work. Okay, so the physical body can also impact you, because it could lead to psycho-emotional stress of not being able to contribute or provide or earn a living. Okay. Here's another example. A lack of sleep can cause an imbalance in the energetic body, and you know how you feel emotionally when you haven't had a good night's sleep, or maybe you can really see it in young children when they haven't had a good sleep and they're grouchy bears, right? Right? And a lot of the body's healing occurs when we're asleep. So if we're not getting good sleep, maybe we're not getting over some of these ailments as fast as we could. So lack of sleep impacts the psycho-emotional and the healing piece. Here's another example. Poor nutrition can impact that physical health. So if you have gut issues or food allergies and you take in the wrong type of food, you know right away sometimes the impact of that nutrition can have on your physical health. And you also know that if you don't eat for a while, what that does to your energy. And poor nutrition, if you don't bring in the right nutrients, that impacts the healing capacity of the body too, right? So there's lots of overlap when we're dealing with these 5 sheaths of mind, body, spirit type approach. Okay, I'd like to go in and just pick apart some of these physical things, and then, pick apart all 5 of these koshas, and then give you some examples of what empowerment opportunities might lie within. Okay, so the physical body. As a physical therapist, lots of people have come to me over the course of my career with pain. Pain is a really big physical contributor. Low back pain, shoulder pain, wherever. Physical dysfunction, and maybe just simply degeneration of the body as it ages. Okay. So what are some of those things? How can I help people, empower people to deal with some of these physical issues? Well, I'm slightly biased, but traditional physiotherapy, of course, is a fantastic place. Okay. But other things are a gentle movement practice, maybe some pain management, okay? And maybe education regarding how sleep impacts your physical pain or nutrition impacts your physical pain. Okay, so the next sheath is the energetic sheath, or the energetic body. And lots of things contribute to that energetic self. So sometimes the problems might be a low mood or energy, perhaps even mental health issues, depression, anxiety. And chronic pain or unrelenting or persistent pain can really impact your energy as well. Okay? So your energetic self is impacted by sleep, by nutrition, by your mental fortitude, by past experiences, all kinds of things. So what might be some empowerment opportunities? What might be some practices to help with the energetic body? I'm a breathwork kind of girl, okay? Mindfulness and meditation. Maybe sleep habits can be examined and improved upon, perhaps. Nutrition. And then, of course, support. So whether that's professional support from a counselor or a coach or a psychologist, might also be medication support. Okay. Or it could be non-professional, like family or groups. Okay. And we do know that positive energy, and it's easy to tell someone, just stay positive. Well, when you're in the depths of despair, that can be kind of hard, right? But we know that positive energy people, their healing capacity and their capacity to withstand health crises is, they are more successful than somebody with a negative outlook on life. So the energetic piece has a big play in our overall health. Okay. The psycho-emotional and social sheath. So some of the problems that I've seen in my clinical practice, people are frustrated, they have anxiety or hopelessness, fear. And in the last 3 years, we've seen a lot of grief and a lot of loss. And the psycho-emotional social sheath is closely connected to the energetic and the spiritual sheath as well. Okay. Mental health is often impacted with chronic disease and deteriorating health. But yet on the flip side, we all know the power of a positive outlook and strong psycho-emotional system too. Okay. So some empowerment opportunities, support and discussion. Okay. Regular self-care and self-compassion practices. And that's an important piece, is the regular self-care. It's not a bubble bath once in a while. These are practices that you invest in on a regular basis. Okay? Sometimes it's laughing and releasing all of those feel-good hormones. It's a powerful tool. And then social connection too. Oh, this is a big one, especially in healthcare, the intellectual sheath. And the problem is that there tends to be such a huge knowledge gap. Think back to that picture near the beginning of the patient lying in the bed and the 5 healthcare professionals surrounding him. So 5 healthcare, I bet there was close to 50 years of formal education amongst those health professionals, right? So there's a huge knowledge gap and experience gap. And that often leads to, as the person, as the patient, or as the client, not understanding, but also not feeling understood. And when you don't feel like you understand and you don't feel like you are being understood or being heard, man, that's not empowering at all. Okay. So empowerment opportunities when we're addressing the intellectual sheath is the education, okay? Knowledge is power, and whether we get that, hopefully we get a good dose of it from our healthcare professionals, okay? From reputable support groups, podcasts and readings, and sometimes our own gut instinct, and sometimes that can be kind of enhanced with a meditation practice. So the intellectual piece I find is really important. And patients are becoming increasingly complex. There's lots of comorbidities. Sometimes there's drug interactions, or there's multiple systems of the body being involved in a situation. Investigations can take time. Okay? And sometimes that leads to gaps in knowledge too. And even with the best of intentions, sometimes the best of practitioners still don't have the answers. And our 5th sheath is the spiritual. Okay. So often the problems associated with this are social isolation, loss and grief, depression. Okay. And there's and loss and grief is stemming from, it could be death, yes, but it could also be loss of a lifestyle, or someone grieving the loss of their youth. So it could be the loss of health from a catastrophic diagnosis, or the loss of someone close to you. Okay. And then I touched on this before, depression and social isolation, not feeling understood, not being able to participate, an overwhelming fatigue, physical, mental. We're hearing a lot of people being burnt out right now, especially our healthcare workers. So we can really end up feeling very depleted in many ways. So the empowerment opportunities here, a gratitude practice, a community connection, and maybe connection with nature or some greater source. Whether that's an organized religion or not, it doesn't have to be, but some type of connection. Okay? And then even exploring within one's own faith system, what else is there that can be supportive at this time? So why can PhysioYoga be so effective? Bias aside, I really believe in a multifaceted approach or an integrated approach, whether we call it the mind, body, spirit, or the 5 sheets. I really love that integration. Okay? And just the awareness and acknowledgement that things like sleep can impact your physical pain, as can stress, as can nutrition. Okay? It is conservative management. It's non-invasive and it has minimal side effects. So when PhysioYoga and approaching something with a mind, body, spirit philosophy, when it's done with guidance and intention, there are very few side effects. There's few side effects to learning more, or moving a bit more gently, or sleeping a bit more restfully, or eating more healthily. All right. So I've shared along the way today, I've shared situations where imbalance in one of the sheets can negatively impact the other sheets. But now I'd like to share a story of a client recently. Okay. I'm going to call her Joan. She was in her 70s and she was coming for physical therapy, and we touched on a few of the other things like sleep and joy and those kinds of things too. But she came back after seeing, after a weekend, and she had tremendous guilt and shame for not doing her physio exercises. She didn't do her homework over the weekend. We peeled back the layers a little bit, and I wanted to get an understanding of why she didn't engage with her exercises on the weekend. And it turns out that her daughter and son-in-law got the opportunity for an unexpected trip away. So Joan and her husband got the grandkids to stay overnight at their house for 4 nights. And they just had such a busy weekend. They were at Kinsman Park. They were biking and walking in the neighborhood and on the school grounds. They baked cookies. They read books. They went to the zoo. Grandma and Grandpa were super active. Right? And there simply wasn't any opportunity for Joan to do her homework. And once the kids were gone, she realized, oh my goodness, I didn't do any of my physio homework all weekend. But she also realized that her shoulder didn't bother her all weekend. She didn't even notice it, despite she didn't do any exercises. She didn't do ice or heat. She was pushing the kids on the swing. She was riding a bike. So despite kind of neglecting her shoulder, she was feeling really good. And I asked her, why do you think that was? She said, I don't know, but I just feel so bad because I haven't done my exercise. And then we started to reframe it into the mind, body, spirit approach to things. Okay? And if you peel back some of those 5 koshas, the weekend with her grandkids, she was able to help out her daughter and son-in-law. And that gave Joan a tremendous sense of purpose. Okay? She was helping her daughter. She got great connection with the grandkids over the weekend. She spent time in nature. There was lots of activity. There were really good sleeps because there was so much activity. And there was just a tremendous amount of joy. There was so much joy for Joan all weekend long. And when you have all of those other things, kind of feeding and supporting what she thought was a physical problem in her shoulder, but yet she paid attention to all these other sheaths, and she felt really great. So what if your healthcare provider prescribed you some meditation or some gentle activity or stress management or some nutrition tips? And what if you felt more empowered to take some action and to be part of the process of your health? Right? What if people engaged in some of the things that we suggested today? Then I really truly believe that there would be a greater sense of empowerment. And with empowerment can come less pain, better sleep, increased function, better mood, more energy, social engagement, all kinds of things, right? And healthy aging, right? It can sometimes take a village. And if healthy aging means addressing each of those individual sheaths, the physical, energetic, psycho-emotional, social, intellectual, and spiritual, if we want to address all of those five, then it may take a village of practitioners, of listeners, of supporters, and those who will laugh with you and move with you and be positive around you. As healthcare providers, we have the role to be part of this person's team and to help them achieve healthy aging. So we have the opportunity to help them achieve that healthy aging status. And I don't believe that any one professional can provide all things. And that's why I really believe that it does take a village. And it takes a village of professionals, but people around us too, our friends, our families, our activities. So I hope that today's talk helped you feel a little bit empowered. I think I will just go ahead and take some questions now from Jill.
Thank you so much, Linda, for the wonderful presentation. I love how you gave us such a great insight into all the different areas and that allow us to be empowered. So, and have the potential to allow us to be even more empowered than maybe we are now. So thank you so much. And I think this was a great presentation for everyone and a wonderful way to celebrate Lung Month. So thank you so much for sharing your time and energy and expertise with us. Just to let everyone know that today's presentation will be posted on our website, lungsas.ca, and it will be under the Lung Life Patient Education webpage. And I will remind everyone who has questions, please, if you haven't already done so, enter them in the question feature, and we'll try and get to all of them. There's quite a few here, and I know our time is limited, but I will get here and I'll try and lump some of the questions together. Okay, so with our first question, Linda, what are some practices that that you do in particular that help you stay empowered?
Great question. And I am not a poster child for this, but I do take, my health is really important to me, and my goal of healthy aging is incredibly important. And so for me, it's an investment now in practices so that when life throws me a curveball, and it will, and it has, but when that happens, I have the resources and the practices to lean on and lean into. I am a regular meditator. Sometimes I do guided meditations. Sometimes I am walking in nature and just so spaced out in the beauty that's around me that that's part of things too. So connection with nature, meditation. My nephews refer to me as the healthy auntie because there's not a lot of junk food in my house. So that's another thing too. So nutrition, meditation, and then that time in nature. I think probably one of my shortcomings would be sleep. I think sleep would be, if someone on the outside were looking in and said, if we could improve things, I think minimizing some of that screen time, or at least screen time around bedtime. Getting rid of some of that is probably one of my weaknesses.
Well, and just thank you for sharing that and being so honest too. We often look at our role models and think that they have it all figured out. So thank you for that. Just kind of in follow up with that, Linda. Would you say that perhaps the different ways that people choose to gain more empowerment, it's really different for everyone,
Oh, I
too?
think that's a great point, Jill. Yeah, for sure. And what resonates for some people doesn't for others. And I'm sure there, even that short 5-minute practice at the beginning of the presentation, right? Some people might have found that really, really great. Others found it too simple and too short. And others, just kind of said, no, this isn't for me at all. So it is finding your own groove. And that's why it's beautiful, because when you have, 5 different areas, intellectual, and, if one of those doesn't feel right, but another one feels really great, then, you kind of get it, the system balances out when you have lots of options to play with. There's lots on the menu to choose from.
Oh, that's wonderful. Thank you. Thank you. Okay. So because we're Lung Sask and because we we work with, well, everyone that we work with has lungs. So we think that we are important to everyone, but certainly we also work with a lot of people that are managing a chronic lung disease, which you talked about managing chronic disease. So just some of the questions here are around, what does empowerment potentially look like for someone with lung disease, for example, coming to your clinic or learning a little bit more about physio yoga?
I think, let me use a patient without disclosing any kind of personal information. We'll keep her anonymous. So here's a couple of things that come to mind. So a woman came to us and she had a lung removed. So now she's compromised kind of going forward, right? And she felt that post-surgery wise, she just felt that breathing was such a problem. And for 2 or 3 years, she just kind of thought that that's the way it was going to be. And then somehow she got connected to us, and some of the tools that we gave her was, first of all, and I love this about the physiotherapy profession, is that we get to take the time so people, and to understand the patient, the client that's sitting in front of us, but to understand their goals and what's important to them too. But we also get to take that time and then formulate strategies in connection with that client who sits in front of us. So it's very team focused, team approach, right? It's a partnership. It's not a top-down white coat. You must take this, you must do that. It's kind of like, what do you think of this? Or what would it be like if we did this? So that's just kind of physio in general. I think that's a pretty great aspect of physio. But listening and making sure that our clients feel heard and understood. So taking time. It had been 2 or 3 years since she had her surgery. So we got to go through the surgery reports and re-educate her, and then add in the impact of the last 3 years onto what changes her body might have seen. So feeling heard and understood, education, addressing that intellectual piece. And then we got into some movement and some breath work, and breath was scary for her. So we really had to peel that back. And I know for a lot of people who are dealing with chronic lung issues, breath can be life-giving, but it can also be a bit of a trigger too. And so being able to take the time and find ways to work that feel right, that don't trigger, that those are some of the things that we've done with her.
Oh, that sounds wonderful. Thank you, Linda. Thank you for answering that question. Thank you. Okay, so there's lots of questions around physio yoga in particular. I think a lot of people are curious about it. Um, a lot of people are wondering what are some of the elements of physio yoga specifically that can maybe be empowering.
Hmm. Right. What can be empowering? Well, because those 5 sheets kind of are in the background of our treatment philosophies, they always get kind of brought up in subtle and not so subtle ways too, to be truthful, right? Certainly we're physical therapists and we're yoga therapists. So the physical body is something that we're very good at addressing and dealing with. But also, if you're in one of our classes and it's kind of like, this would be a really great practice to do right before you go to sleep. So to, be a positive influence on sleep. So impacting the energetic piece, or maybe in a one-on-one session, we dive in a little bit into what some nutritional habits are like, or what stress management is like, because you can't silo those out of anything, I believe. And sometimes it's just the awareness and the acknowledgement of things. And we had a client last month, I think, and he basically came in because he was having such trouble. He was so tensioned. He was just like wound up like a spring, really, really tight. And he was very jittery and, was very uncomfortable sitting still. And our clinician one of the things that she uncovered was that he was on an anti-anxiety medication that he stopped, but from a healthcare professional, from his healthcare team. He was on this medication. He didn't like how it felt. So he stopped it cold turkey, but he didn't tell that practitioner. So the role of our therapist there was, I encourage you to go back and talk to this practitioner about medication and see if there's something else that could be done. So sometimes it's referring out to other people on the team, or encouraging people just to kind of take a step back and say, here's what might be happening when you do something like, I don't know, stop your medication cold turkey.
Right.
By no means do we claim to be a pharmacist, but at the same time, we do recognize that sometimes those medications are a really important piece, and the client needs to be referred back to that practitioner.
That's that village that you were talking about.
Right. Yeah.
Yeah. Yeah.
He comes back in 2 weeks later. He's been doing some of the breath work. He's on a different medication. He was a completely different man.
Yeah.
And yeah, so it was nice to be part of that. And yeah, it was nice to give him some power and some of his kind of former life and some control back into a situation.
And that's where you really saw the mental side of things affecting the physical side of things.
Right.
They go hand in hand.
Yeah.
Yeah. Wonderful. Okay. Well, Linda, I just can't thank you enough for joining us. It has been such a pleasure. And I think we could all just listen to you um, forever. But that is all the time that we have. So thank you for being one of our presenters, our final presenter actually in our Lung Life webinar series sponsored by GSK. And what a great way to wrap up this series. What a great way to celebrate Lung Month, you and all of you out there. So thank you to everyone that joined. We really, really appreciate it. And again, thank you to GSK. If you've missed if you want to watch this webinar again, or if you missed any of the other ones in the series, you can watch them. They've all been recorded and they'll be posted on lungsask.ca. So thank you very much, everyone. Have a good night. Take good care of yourselves. I hope we're all feeling a little bit more empowered, and happy Lung Month.